Welcome to the Pompey Politics Podcast.
I'm Ian Tiny Morris.
And I'm Simon Sainsbury.
Hello, and if you're watching this live, it's Sunday the 1st of December, and if you're one of our regular watchers and listeners that likes to join in the comments this evening, although this is going out on Sunday, we are recording the show on Thursday, so you won't get the usual levels of dynamic interaction you do from Simon. But hopefully we've got a interesting and enlightening show for you, as once again we have a very knowledgeable guest with us, Simon.
We do indeed. We are joined this evening by CP from Portsmouth Pride. So welcome, CP.
Good evening, gents.
Thank you very much for joining us.
Oh, thank you for having me.
So December the 1st, really important. I've now forgotten who was doing the odds and evens. Sorry, Ian, you said.
Yeah, it's you to lead off. Keep going.
Sorry.
Keep going.
Professional to a fault.
It gets better than this.
Yeah, honestly. Well, at least I haven't stuffed up your name like I have done in the last two shows. So CP, I think the best place to start is if you can please introduce yourself and talk about how you became involved with Portsmouth Pride.
Yeah, sure. So hello to your listeners. I'm CP Robinson. I'm one of the chairs of the Portsmouth Pride Trust, which is the charity behind the familiar Portsmouth Pride event and work year round. I became involved in Portsmouth Pride initially in 2020, 2021, around then as a volunteer, became a trustee a few years later, and then vice chair and later co-chair, and really got involved because I had a passion to create an inclusive community. And over the years, I've had the privilege through Portsmouth Pride of working with a lot of different organisations across the city, corporate, civic, voluntary community organisations on initiatives that celebrate that diversity and tackle discrimination as well.
Fantastic, thank you.
That's brilliant. So December the 1st, World AIDS Day, really important. What does it signify and why is it so important, CP?
Really, it's an annual opportunity, more than anything, to unite globally, because AIDS and HIV is a global issue. It gives us that opportunity to remember those that have died from AIDS-related illnesses. So lots of towns and cities run vigils and remembrance events. And it's an opportunity for us to show support for people that are living with HIV now as well. Every year there is a different focus to the event, so much like events like LGBT History Month, there's a specific focus every year. And in 2024, the focus is combating HIV stigma, which is still a major barrier for us ending new transmissions and also for improving, I suppose, the quality of life for people that are still living with HIV. And there's a target in the UK to have no new transmissions by 2030. And that stigma is still part of that challenge. Locally, obviously there's the world piece. World AIDS Day is recognised around the globe. Locally for us in Portsmouth, we've held a World AIDS Day event. This is our second year. And this year we're using it as an opportunity to bring together over 150 of our stakeholders to share updates on some of our work around UK Pride, but also to hear from some really inspirational speakers who challenge misconceptions around HIV and have that lived experience as well.
Brilliant. And it sounds like it's something locally that the community is coming together around and supporting.
Yeah, really behind some work that we've undertaken in this past probably 18 months or so. Actually, the artwork that you can just about see behind me was commissioned for our World AIDS Day event last year, when we announced a big project that we'd be running in 2024, which was a mural down on Southsea seafront, so by the Queen's Hotel, which was installed in the summer of this year with artworks created by 3 different artists from around the world, all with a message of HIV positivity. And that was backed up by a public health campaign that was sharing positive messaging around HIV. So both an educational piece saying that anybody can be HIV positive. It's not a gay men's disease. It's not even just a men's issue. It's not something that only exists in Africa. It's anybody can be HIV positive, but also that it's everybody's responsibility to help tackle that stigma and end the stigma to become positive about HIV. So there was a double message in there. And yeah, that mural had a history from there, but that was really why we wanted to make sure we were kind of taking the space to mark this day as well.
That's brilliant.
Okay, talking about you talked there about the stigma and about it not being confined to any particular group. And just as a kind of context, I just wanted to show quickly from I think it was 1987, the UK government's Iceberg campaign, and just share that because some of our viewers and listeners may not either remember it or may not have been aware of it. But I think it'd be interesting to kind of see that context compared to kind of how things now, and then ask you what the difference is. So let's have a watch of that quickly.
There is now a deadly virus which anyone can catch from sex with an infected person. But you can't always tell if someone is infected. And unless we're all a lot more careful, the people who've died so far will be just the tip of the iceberg. So protect yourself. It's safer if you use a condom. And remember, the more sexual partners, the greater the risk.
Well, blunt and chilling thing. How was the societal media attitudes to AIDS that were around at the time of that campaign compared to how are they now?
Yeah, well, you think the video that you showed there, which was the Iceberg campaign, and there was the monolith video as well, which was similar, that people might remember, the big piece of granite that was kind of chiseled in. And I think they're brilliant things to still see, but they're historical artifacts now. They were really powerful at the time, very, very powerful, and kind of widely thought of as being very successful public health campaigns to kind of quell the spread of HIV in the late 80s. But they were rooted in fear. That was the tactic at the time, was spreading fear, painting HIV as a death sentence, reinforcing stigma, reinforcing that perpetual misinformation around HIV. I mean, thankfully, we didn't have social media in the same way in 1987. Otherwise, this could have been a horrendous spread of stigma and misinformation. Now, the attitudes toward HIV have shifted. We're talking much more now about education, much more about empowerment, much more around emphasizing to people that HIV is manageable with treatment. And those living with HIV can lead long, healthy lives. It's not the same disease that was in those health campaigns back in the 80s. While I suppose that awareness has improved, there are still echoes in the current community. You know, we had TV shows like It's a Sin, which was really incredible. And great because it was a British reference, and people really loved the work of Russell T Davies. But there was also work like Pose, FX's Pose, which is also a similar time period, but an American version. We've got great representation like that, but there are still echoes of fear-based messaging. There's still that lingering stigma, which still kind of exists. So we're not there yet.
You touched in there about the sort of health aspects, and obviously, you know, a very doom-laden campaign at the time, and again, reference back to you know that series It's a Sin, and you know it portrayed how it was then. In terms of the medical kind of model and outlook, how much have things changed in those sort of best part of 40 years, and what are the outlook and prognosis now, I guess, for people, and is there a difference between, you know, outcome in the wealthy West, and I think you touched on Africa when you led us in, so
yeah,
you can unpack that a bit for us.
Yeah, and it's actually a conversation I was having recently about we still have living members of the community that were impacted by HIV in the 80s, and allies, and lots of them lesbian women that were caring for gay men at the time, and lots of just people in the wider community that remember the TV advert. They remember sitting eating a TV dinner and the big tombstone monolith coming on screen. So it's living memory development, which is quite interesting as a historical context. But that means it gives us a really good opportunity to look at the really tremendous progress that has been made in that less than 40 years. So from a UK perspective, we have effective antiretroviral therapy. So people with HIV can achieve what they call an undetectable viral load, which is a really odd phrase, but it basically means they can't transmit the virus. It's at such low levels in their blood that it's not detectable and it's not transmissible in their blood, and that's with quite simple, effective medication. HIV now, it's considered as a manageable condition for most people, and we also have PrEP, which is pre-exposure prophylaxis. That's very widely available in the UK, which really reduces the risk of acquiring HIV as well. So real tremendous progress in the UK, but the misinformation still exists, and not everybody knows how far the science has advanced. And we're quite lucky in the UK and in the modern West. We have these pharmaceuticals that have been developed that are not available in every country around the world. Even within the developed West, there's disparity within this. The mural I spoke about earlier was funded by Gilead Life Sciences, who are the big pharma, basically, that developed PrEP in the US. And in the US, they still own the patent to PrEP. So it costs American LGBTQ plus people that want access to PrEP a lot of money if it's not on their insurance, but actually it costs our NHS a relatively low amount. It costs the Australians also a relatively low amount. So there's disparity even once we've got the access to the medicine. Just because it exists doesn't mean that it's widely accessible in the West or in developing countries either.
So again, is that a time issue for the patent to expire, or is it one of those products that is very difficult to replicate? So the prices, do you hope for the prices to come down, or do you see them remaining high and out of reach of most of the world?
Yeah, so there's no patent for it in the UK. So we have generic brand PrEP essentially. So it's widely accessible. In the US, it's money and politics that prevents it from getting more accessible in the US, and that's exactly the same as what stops it getting into other countries as well. There's an awful lot of work being done by big international charities to change the face of HIV/AIDS around the world. And actually, at our event that today, now on World AIDS Day, we're raising money for the Elton John AIDS Foundation. So taking a more global approach, whereas last year we raised money for the National AIDS Trust.
And I guess that within the community, there's often a lot made of people being good allies, and we will definitely come on to that later. And I guess, is that what you're seeing, is kind of more allyship with hands reaching out across the world to support those that are not in a position to support themselves?
Yeah. It's our responsibility, you think, as global citizens to be allies in whatever way that means for us. We take that mantle, I suppose, from people like the nurses who worked in hospitals and the community volunteers who worked in community settings in the hospitals in the 80s. One of whom is also speaking at our event on World AIDS Day, because she's the wife of an amazing chap called Andrew Major, who's rowing across the Atlantic for the Elton John AIDS Foundation, and she nursed during HIV in the 80s. So we take that mantle of those people that this is nothing to do with me, it's not affecting me, my life, my friends, but it is something to take action on. And I think as anybody that's socially minded or engaged in anything to do with human rights locally or globally, we take an interest and try to be the best allies that we can be.
Okay. So, I mean, does you touched on it a bit there, was a bit before in your answer. Does the stigma and ignorance still exist despite those 40 years, and like you say, thankfully we didn't have social media at the time that those sorts of messages were coming out from government. Does that stigma still exist? Have we still? I mean, I remember kind of things like certain newspapers. We won't name them, but certain newspapers seeming to gleefully share terrible, fear-ridden stories about infection spread, or stories of people that were found to be positive instantly lost their jobs, things like that. Does that still exist? Is that still something happening?
To a degree, yeah, nowhere near to the level it was in the 80s, but the stigma and ignorance really around HIV and AIDS definitely still exists, and that's fueled by outdated beliefs, really, and a lack of awareness. Lots of people, like you say, remember newspaper headlines of the late 80s, early 90s. Lots of people remember the TV adverts, and even now the media portrayals, like It's a Sin and like Pose, are historical references, but they're in a 2023, 2024 setting, so they don't necessarily give you an accurate portrayal of what modern day experience is of living with HIV. So many people still associate HIV with specific communities or specific behaviours. That just perpetuates a prejudice, and the outdated belief and the lack of awareness is all in that same space. So the media portrayals and the education often lags behind what the science is, and we're not having then enough open conversations about HIV in everyday settings. So even in medical settings, going to a pharmacy, I take PrEP every day to reduce my risk of catching HIV, and I have a little card that says what the drugs are that are actually in the medication. You go to any pharmacy and you ask for whatever it is that you want, and they say, "Oh, you want any other medication?" And I'll say, "Yeah, I'm on daily PrEP," and sometimes they'll have no idea what it is. If they do know vaguely what it is, or there's a follow-up question about, "Oh, what's that for?" and you say, "Oh, it's to prevent me from catching HIV," there's an immediate switch in the way that they deal with you, because they think you mean you've got HIV and you're trying for it to not impact your body. They just don't understand what it is that you mean. Even if you pull the little card out, which is a NHS produced card, they still don't often know what it is you're talking about. And that's like the softest entry point for talking about HIV, is somebody that doesn't have HIV but is on daily medication to mean that you severely reduce the risk. That's nothing then to talk about people that are living with HIV and going through similar things, of having to say to the dentist, to the GP, to your pharmacist, to any healthcare setting that you go to a tattoo shop, anywhere that blood might be drawn, anywhere there's a chance of a risk of infection, having to make that disclosure. So yeah, the stigma is definitely still there, and we really saw that the stigma was still there when our mural went up over the summer, because within a few days it had been entirely vandalized. 80 meters of mural that cost quite a lot of money to put up, that was part of a big project that we'd done, consulting with the community, working with artists around the world, engaging local people that were either children of people affected by the infected blood scandal, or those living with HIV, or those that nursed in the 80s, all came to be part of our mural, putting this up, spreading positive messaging around HIV. And it was cartoons with smiley faces on, and really gorgeous artworks, and it was all defaced within 72 hours.
And was the
stigma still exists?
And was it just mindless defacing, or was that defacing with some sort of message or response to the message of the mural?
It was torn down. So these were paste up works that were put around the entire hoardings, and they were ripped off. And in some cases where the glue and the adhesive had worked a bit better, they couldn't take some of the posters off, so they scratched the word HIV out of some of the posters, because one of the posters was just a title poster that took you through a QR code to a website landing page that has lots of myth busting and lots of information on it, which just says HIV positive, and the QR code and the word HIV was scratched out.
It's kind of hard to kind of understand that. Is it because the situation, both medically and societally, has to a degree dropped off the radar? It's not. I mean, it seemed to be a thing that was in a media sense present in like the 80s and 90s, but not in a good way at all, in a horrible way.
Yeah.
But almost is the silence equally bad?
Yeah. That's it. That's where that media portrayal piece now is still lagging behind the science, and we don't have these present day representative conversations about what HIV means in 2024. The statistic changed, I think it was 2019 or 2020. In the UK, new infection rates were higher in not gay men than they were in gay men. So more straight people essentially were catching HIV than gay people were. That wasn't sensationalized anywhere in the news, anywhere in the media. There was no big education piece. There was no big warning anywhere. So yes, infection rates have obviously dropped drastically. New infection rates have really dropped drastically. They're not at zero though. And I think there was probably an element of people just wanting to stick their heads in the sand. That was a thing in the 80s. It was big media at the time. We don't want to know about it. We don't want to talk about it. Or because we don't have these positive representations now in kind of a modern context, like we said earlier, the only point of reference that people have for HIV is the monolith, is the iceberg. And even those modern representations that we have, like It's a Sin and Pose, are still representations of what it was like in the 80s. You know, It's a Sin is heart-wrenching because you see what happens to these communities, but that is not what's happening now. But we've not overcome all of that stigma yet.
No, and it for me, it's fascinating to kind of hear that, because, you know, full disclosure, I grew up in the, you know, I was 18 in 1987, so, you know, I remember that time, and I remember the adverts, and it's that, you know, I kind of recognised that, you know, things had moved on, but it's only in that conversation with you today, it's that where there has never been, or not to my knowledge, a modern day representation of you know, what does it mean now? So I guess that kind of leads me on to that question in terms of, you know, what can people do to be good allies to those people who still, you know, still have HIV, but also to that sort of wider community to help and educate.
I think there's things that everybody can do to be allies to those with HIV, and to spread the awareness. I think the first piece is around education. So one of my big things around anything that we ever talk about at Portsmouth Pride, whether it's pronouns or gender identity or inclusion of people from the global majority, absolutely anything, is Google is free. You can educate yourself. You can learn the facts about HIV. You can understand U equals U, undetectable equals untransmissible, and what the advancements are in treatment. The QR code that I mentioned takes you through to a website called Queer All Year, which is one of the campaign arms of Portsmouth Pride that ran the HIV positive campaign. But if you search for Portsmouth Pride HIV positive on Google, you'll get an amazing resource there of information dispelling a load of myths, work that we collaborated on with Portsmouth City Council, and their Principal Public Health Officer, Hannah Byrne, is one of our biggest advocates nationally for HIV transmissions in the city. She's wonderful, and she's got some amazing resources. Challenging the stigma is really important. So it's as many people as possible speaking out against those harmful stereotypes, correcting that misinformation if you encounter it. Again, these are all things that how to be a great ally for somebody with HIV is how to be a great ally for a lot of different areas, supporting the initiatives that are already out there. So joining events that you can find like World AIDS Day, or supporting organisations that combat stigma. The Terence Higgins Trust is an incredible charity, and they have the quilt. The Terence Higgins Trust quilt is part of the National AIDS Memorial Quilt, and the Terence Higgins Trust section is currently in the National Museum of the Royal Navy in Portsmouth, because Terence served for a number of years. That's really stunning to go and see. I think it's there for another week or so, till about the 9th of December, I think. There are other amazing charities out there as well. There's the National AIDS Trust in the UK, Elton John AIDS Foundation, many, many more. Just being an ally in general. So treating people with HIV with respect, just like you would anybody else, asking open questions, trying to understand them better, and then finally sharing messages. So where 1987, we didn't have social media, which thankfully, because the misinformation wasn't spread. Now we do have social media. We all have platforms where we can amplify campaigns. And that's the great thing about campaigns. So there's the Portsmouth Pride recent mural, which was funded by Gilead. That's all about raising awareness and fostering some community dialogue. So sharing it and engaging in that dialogue is really powerful as well. So I think that's 5. I'll stay at 5 because I like an odd number for a list. But ways that, your listeners and your viewers can really be allies to those with HIV.
Yeah, and I guess the message I take from that, CP, is you've only got to look, and it's not going to be difficult to find.
Be responsible for your own learning. That's what we all have to do on everything. I was on I think it was the Shaping Portsmouth podcast a couple of weeks ago, and we had a good conversation about language changing, and especially with anything to do with the LGBTQ plus community. There's always new language coming out and being used and being adopted by the community. There is, but I really like it as an example when we get to talk about things like this on podcasts, because 15 years ago the word podcast didn't make sense, but now we're recording one all from our own homes, and this is going out to people that are going to listen to it from home that all know what the word podcast means. We all learned what vlogging and blogging and everything else was. Just be responsible for your own learning. It's what we'll do throughout life.
Yeah, no, and the language is always very interesting, because, as I say, I grew up in the 80s, and it's that education. The word queer in the 80s was not owned by the community at all. And it, as you say, language always evolves and grows. Well, that has been so insightful. Really appreciate that. I'm going to throw to Simon now just to talk about a little bit more about Pride and what's happening next year.
All of those great instances that you shared, we'll grab the links and we'll share them in the description sections for the show, so they're all there for people to follow. Thinking about next year, we're nearly done with 2024. Next year is a really exciting year for Portsmouth and for Pride. What's happening?
Yeah, so something else that we're doing actually at our event on World AIDS Day is talking to all of our stakeholders, people that we work with in the community, because we announced in December 2023 is when we announced it, that Portsmouth has won the bid to host a UK Pride in 2025, which is a title that one Pride from the 260 community-run prides across the UK is awarded each year, so that the title moves around every year, and we're hosting in 2025. So from the 17th of January, which is our official kind of starting date, through to the 7th of June, there are 25 events already planned in 25 in 25 for people right across the city to get involved in, some in person, some digital, some ticketed, lots mostly free, and that's just the starting point. So there will be more and more added for people across the city to get involved in UK Pride. That all culminates on the 7th of June on Southsea Common with the Portsmouth Pride event that people will be familiar with. That is, as always, completely free and completely unfenced. So you can come and sit right up against the stage and cheer and scream, or you can sit a mile back from the stage, kind of closer over to the D-Day Museum, bring your picnic blankets and your chairs, bring all of your own food and drink, There's absolutely no cost coming down, so it's just going to be a wonderful day celebrating the rest of the year-round work.
Fantastic! So we look forward for some more information about all of those events, kind of coming in from January the 17th. And it'd be great to see all of those things. So it's a great thing for the city. So well done for securing that, and it'll be interesting to see what comes from it. Okay, well, CP, we've really appreciated you taking the time to come on this evening and help our viewers and listeners understand actually the what World AIDS Day is about, and why it's actually still important, and actually why it's actually really relevant now to understand it. Was there anything else you wanted to close out with as a passing thought?
No, just really thank you for having me on. Like I said, in the kind of call to action, sharing the messages and getting involved in World AIDS Day events around the globe is one of the ways that we can help to battle the stigma. So thank you both for giving us that platform to be able to talk about it to all of your listeners as well.
You're more than welcome.
That's absolutely more than welcome, and without wishing to tease too much, we are in discussions to see whether we can support some of the events in the new year, and perhaps give Simon's a few more grey hairs.
Little hair there is left.
Live podcast, which is always exciting. So thank you ever so much, CP. You've been listening to the Pompey Politics Podcast. I've been Ian Tiny Morris.
Our guest this evening has been CP from Portsmouth Pride. Thank you. And I've been Simon Sansbury. Please do join us next week at 6:27 on Sunday the 8th of December, when we'll be travelling slightly eastwards to hear about what's going on in Havant Borough Council. Don't forget to like, follow and comment on Facebook, or comment and subscribe on YouTube. Find us on all the social media platforms: Facebook, X, YouTube, Threads, LinkedIn.